Veterinarians of Reddit, what is one thing you wish people would know understand about their pet? About their pet, the best one I know is one I heard a while ago. You have your life, your job, your friends, your family to provide your social interaction per day. Your dog only has you. Interact with your dog for more than 5 minutes per day and maybe your dog will not go out barking every 5 seconds. I heard something similar. That logic is what urged me to make the habit of taking my dog for 4-5 walks a day. He can interact with other dogs and with the world around him that way. If your pet eats your weed stash, let the vet know. They are not going to call the police. They need to know everything they can to diagnose your pet. Don't complain about your dog not having boundaries when you're literally feeding them scraps off your plate at dinner time. That's 100% on you. Vet in the UK. 1. The sounds that flat-faced dogs make are not normal. 2. There is no such thing as he/she is just a bit stiff, but he/she is not in pain. It's just her old age. If your dog cat is stiff or slowing down on walks, then it's very likely they are in pain. 3. On the same note, pain relief is important. Yes, all pain relief has side effects just like all human medication does, but please don't let your pet suffer. 4. If your vet says your dog cat needs a dental, then please follow their advice. I've seen some horrendous mouths covered in calculus with teeth falling out, and the poor animals had to put up with it for years because he/she is still eating, so her teeth must be fine. Number 2 is one of the worst ones. Your pet doesn't have to be limping, yelping or non-ambulatory before they should get some pain relief. RVT here. Exotic animals, reptiles, birds, small mammals such as rabbits, hamsters, guinea pigs and rodents may be easy to acquire and assumingly easier to take care of, but most of these animals have very specific housing and dietary needs that need to be met and require enrichment. Also, not every veterinarian has experience with exotic animals, and exotic animal medicine is sometimes at a premium but is still necessary. I've met a lot of people who get a small mammal or a small bird for like $20 from the pet store and then won't pay for medical care because it costs way more than the pet was purchased for. Vaccines you get at the drugstore on the corner or the feed and tack shop are not as good or the same as the ones you get at the vet. Just because your dog is scratching its ears does not mean it has ear mites. Your cat is not urinating outside the box because it's a jerk. It might be. It probably has an infection. Not eating for 3 days while vomiting and having diarrhea is a huge deal. That 5 pounds Chihuahua or even 80 pounds lab can't lose that many fluids without having any intake and be okay, and neither would you. RVT here. There are so many. 1. It is not cute or sweet to have an obese pet. It can cause joint issues and heart disease among many things. Stop showing love through overfeeding, especially human junk food. 2. Dogs are living creatures who need preventative medical care just like you do, and sometimes they get sick like you do. If you can't contribute the bare minimum to take care of them, maybe you should think again about owning one. 3. Get your puppy its dang distemper parvo vaccines. Adding on, heartworm prevention costs much less than treatment. Not a vet, but my mom is. One thing that really frustrates her is the myth that neutering a cat will make them fat and lazy. It reduces the amount of calories they need, which means they need less food and or more exercise to maintain the same weight. Cats generally get less energetic as they get older regardless, but most will still perk up if you make the effort to wave a toy in their face every so often. I'm a vet. 99% of patients are okay with drop-off appointments due to COVID. The number of clients claiming my pet has severe anxiety, I can't believe you're making him go in alone, is quite high. Almost all pets are fine, and the ones who aren't fine, I've allowed owners in the building to help. There's been 2 since March who actually were in distress despite people complaining daily about it being an issue. Also, I think people need to learn more about the medical process in general. Tests are usually required to make a diagnosis. Sometimes even with tests the diagnosis is grey. Sometimes spending all the money will not guarantee success. Many times there's not a magic shot I can give to fix it. Don't buy a dog only because you like the way it looks. Huskies and most sorts of shepherds are working dogs. They need lots of activities to be happy, and they often turn aggressive if they do not get enough of it. On this note, look into any breed of dog you want to buy and what it needs. Egg. Jack Russells are terriers and were bred for hunting foxes on farms. They need adventure, play, space and regular exercise. Just because it's small and looks cute doesn't mean you can keep it cooped up in an apartment. This is why there are so many yapping, unhappy, aggressive dogs around annoying everyone's neighbors. I am a vet. I wish people just even had a basic understanding of dog or cat body language. FFS. The number of videos posted on Reddit of animals in distress and it's tagged as "oh my little fluffster is so cute when he plays" or whatever makes my blood boil. That kind of moronic ignorance is what gets children bit by the pet dog or the cat who is now dying because the owner had no idea of the signs 4 months ago. Edit. Cheers for the awards, kind strangers. I don't know why you did, but you are cool peeps. Oh man. The dog and baby videos kill me. You've got a dog with flat ears and curling lips trying to back away from a kid and the poster is all "look how sweet pork chop is with Maddie." Mom, that's not sweet. Your dog's about to decapitate your child. I wish that they understand that they have a live creature that need all type of cares, not just medical but environment enrichment, a correct and health feeding, and why not even emotional care. But the average pet owner think that him/her just have a teddy bear or something. It took my husband years to really understand our cat was a being with its own personality, preferences, habits, and likes, routines. Our cat is not just a pet, she is a being with her own wants and needs. If you want to cuddle and she doesn't, respect that. She was his first pet. If you see a stray cat with a cleanly clipped ear tip, do not take it to a shelter. Either take it home to live with you or leave it on the street. Clipped ears mean they were caught, neutered, spayed by the city, county, and released. This is a way to control cat populations and, over time, protect wildlife. They compete for resources with fertile cats without adding to the population. In many cities, stray cats are more likely to be adopted from the street than in the shelter. If the cat is taken to a shelter, they cannot legally release it because it is now abandoning the animal. That cat will be euthanized, or at best absorbs resources until it finds a home. If your cat or dog was hit by a car and is whining and limping, when you bring them in and get asked when the accident happened, the dang answer best not be "oh, 4-5 days ago, but I haven't had time to bring him in." Source equals wife is a surgical vet nurse. Ripping your cat's claws out to preserve your furniture is absolutely disgusting and inhumane. Don't justify it by saying that at least you're giving him/her a good home. You're depriving the animal of one of the core essence of being a cat. I only found out recently that it's like amputating the tips of your fingers from watching Kyle Hill. Thankfully none of our family pets have had to endure this, but it's still a horrifying thought. Vet here. Here's my best advice, condensed. 1. Thin pets live longer than fat pets. Google a BCS chart and make sure your pet has a visible waist and palpable ribs. No crash diets. 2. Dental disease is way more serious than you think. Get the scale and polish. If we have to extract teeth, and believe me, we would prefer not to, they will still be able to eat. 3. Get your pet a series of Cartrophin, or Zydax, or Pentazone polysulfate injections when they turn 8. They help slow down the progression of arthritis and are safe and cost effective. 4. If your cat is stressed at the vet, take home some gabapentin to put on her food before her next visit. She will be safe, happy, and calm, and the vet will be able to examine her more thoroughly. 5. Know what's toxic for your pet. Definitely don't have lilies in the house if you have a cat. 6. Discuss finances. Your vet wants what's best for your pet and is obligated to recommend all your best options. But if you tell us what you can afford, we can usually work with it. 7. You deserve a vet you trust. If you don't trust yours, find one that you do. 8. Put your 24-hour vet's address into your Google Maps GPS favorites so you don't have to find it in an emergency. 9. High quality kibble is fine unless your vet tells you otherwise. 10. You can almost definitely give your cat a pill. Ask us for tricks. 11. Be nice. We are human and we all care intensely. Even if we hate you, we probably love your pet. Bit depressing that you felt number 11 was required. Honestly, people suck. RVT, not vet here. Just because you can't afford your pet's medical care does not mean we are horrible people for not treating for free. Vets' offices are not non-profit. Your pet's wellness is your responsibility. Quit laying the blame on us when you won't pay for needed care. We love your pet, even when they hate us. We honestly try to make them feel safe and comfortable. But what we have to do is scary and sometimes hurts. We don't think less of you as an owner when your pet is upset or gets aggressive. Please tell us if your pet has been known to bite, freak, scratch at the vets. Seriously, I'm still gonna love and care for him, but now I have needed info to keep me and the rest of the staff safe. Anesthesia is dangerous. Routine procedures are still risky. We do everything we can to keep your pet safe, but sometimes bad things happen. As your pet gets older, we need to see them more often. We are better able to help normal aging issues if we catch them early. So yes, blood work and exams are super important in older pets. Fat pets are not cute. They are unhealthy. One of my saying is, if this pet was as skinny as it is fat, we would call animal control. You are your pet's advocate. We trust that you know your pet's best. So if you think something is wrong, be the advocate. We need to hear you. Don't send your 16-year-old with your pet if they have no idea what's going on and no way to reach you. Same goes for spouse. Most states have laws requiring a valid patient-owner-doctor relationship before prescribing medications. So no, we can't refill your pet's ear medicines if we haven't seen them 2 years. Even if you say he is having the exact same symptoms, vets can lose their license. Please don't be mad at your 5-hour wait at the animal. Be glad your pet is a lower priority. Tridge isn't a game you want to win. We will happily take care of your pet's broken toenail once we stabilize the dog in heart failure, stop the puppy dropped on its head from seizing, and sew up the dog that got attacked by its housemate. I know waiting sucks, and to you, your dog is the most important, but we aren't sitting around doing nothing while you wait. We are trying to save the life of someone else's best friend. So much more. I really love my job and the amazing pets and owners I privilege to work with every day. We are a team. We want to work with you, within your budget and level of comfort, to provide the best possible care for your best friend. My hope is that you want the same thing, to be on the same team. Not a vet but a volunteer with a bird rescue. Parrots require a lot of work. Avian vets are super expensive. FFS, don't pet your parrot anywhere but its head, otherwise you are masturbating them. It's not cute. They look happy because you are wanking them off. From my former vet tech girlfriend, don't leave your pets to be euthanized without you. It's hard to be there and it's hard to watch, but if you leave them they will die scared and looking for you. She had to try and comfort pets whose owners couldn't bring themselves to stay, and it's one of the few things that makes her cry. Don't declaw your cats. It's basically like cutting the top of your finger off, plus it can lead to infections. 5 years vet tech assist. 1. If your pet is scratching and we find flea dirt, then your pet has fleas. Just because you take one pet out for just a few minutes doesn't mean they can't get fleas. Accept it. Treat it. Prevent it. 2. Stop feeding table scraps. Pancreatitis sucks for everyone involved and is an expensive treatment. 3. Yes, we recommend heartworm prevention all year around. We are not in it for the money. We are in the south. It doesn't stay cold enough to keep the pests away. 4. Your clearly aggressive animal isn't cute behavior. Period. Your rabbit is not a freaking hamster. It needs actual space to run around, and not a single cage sold at a commercial pet store has even close to enough space. They need runs and access to the house if you can. They are incredibly social animals, so don't come to me and say you got one. They are lonely and need a buddy. If they don't have one, be prepared to spend 6+ hours a day hanging out and socializing with them because they need the interaction. They do not just eat pellets. 80-90% of their diet should be hay, and I'm tired of people coming in with morbidly obese rabbits as a result of the rabbit being fed nothing but calorie-dense pellets and carrots. And stop buying pugs from breeders. Bringing more of those poor suffering creatures into this world is inhumane. What anxiety actually looks like in animals, especially dogs, and how unfair it is to the animal. People don't know that yawning, side eye, lip licking, constant paw licking, etc. are signs of anxiety. That is your animal trying to speak to you and their surroundings that they aren't okay. Over time it can escalate when they aren't heard, up to biting. and the only way I can really intervene as a vet is some behavioral therapy, but mostly through lifelong meds. Many clients hate giving anxiety meds because it is a daily commitment and or they don't believe it is a big deal. They don't think that their animal feels anxiety because they perceive the animal to have had a good life and what they do is just a quirk. Furthermore, if they stop some of the meds, the animal will be chemically resistant when you try use them again, like Prozac. Animals can't really go to a therapist like we can, but also it's unfair to let them live in states of extreme anxiety. Think of those moments when you have a situation, or no obvious trigger, that you feel your stomach drop, you can't focus, and you have that sense of impending doom you can't shake. Animals feel that too. Also, don't get me started on behavior misinformation. Dominance alpha theory, ignoring your animal when you come home, leave, purposely switching up your routine so they can't tell you're leaving. All bulls. There are so many things, but I really want people to realize that while puppies are cute, they need appropriate socialization and training, especially when that cute puppy will grow up to be huge. I have seen many young dogs this year since COVID-19 has left many people with free time on their hands. They obviously aren't using this free time working on their pet's behavior though. Nothing like juvenile dogs who don't know how to walk on a leash, will literally knock you down, or will just try to bite you if you get near them, or a young dog who is terrified of everything. Also, update your concept of training to this century please. No self-respecting behaviorist or trainer will use dominance theory or negative reinforcers like shock collars. Evidence-based research has shown us this is not the way. It breaks my heart when people take their dog to a trainer and it gets worse because of the methodology used. Not a vet, someone who would have been fricked if not for savings. If you can't afford pet insurance, see if you can afford half, or even a quarter of it. Save that half quarter in a bank account or a safe or something, and do not touch it. That is your pet emergency fund. No, an emergency is not, but that toy looks so cool, my pet would love it. An emergency is some evil sea kids let my pet out, and he got hit by a car. An emergency is I had to adopt my pet at 4 weeks old because he was in an unsafe environment, and his eyes were underdeveloped, so he got conjunctivitis which turned into a deadly infection and he needed antibiotics for almost 2 months. An emergency is also my car broke down. Now I can't afford my pet's vaccines, but it's fine. I have the emergency fund. Aha, vaccines matter. The only reason my dog is alive is because I had £600 in savings I could use on him when emergency scenario A happened. As for B, I didn't have a fund for the guy yet, but at least I could afford his treatment, which wasn't too expensive anyway. Save anything you can. Even $5 pound symbol 5/year 5/ whatever a week. I think your pet's life is more important than your pretentious and overpriced Saturday Starbucks drink. So if you have to give that up to save, so fricking be it. Am I thinking of a specific prick who chose Starbucks over a cat that died because the owner wasn't prepared? Yes, I fricking am. Not a vet, but my sister is. Vet care is not free. There are a crazy number of clients who think that vet care should be free because if they charge money they must hate animals and like to watch them suffer. Whoa, I rant about that so many times to my co-workers, lol. 1. Having an obese pet is not cute. 2. Even if your pet is a darling at home, it still can bite me and you shouldn't judge me if I put on a muzzle. Even more if it's a big, angry dog cat. 3. Your pet has moods, just like a human. 4. Any change in behavior of your pet should be critically looked at. Why is it that your pet suddenly growls, bites when you touch it in a special place? Could it have pain there? 5. I don't know how many times I said that, but most people bring in their pet when it's too late. I had so many cases where I had to use much more expensive treatment cause Karen was too lazy to come here with her cat who obviously had a tumor. 6. I wish people would understand a pet is not a toy for your children you buy and stuff away whenever you're done with it. 7. It's not cool to make your dog into a killer machine. Especially if I, the vet, have to give it a shot, etc. Yep, sometimes I highly doubt some people should be allowed to even own stuffed toys. Not a veterinarian, but I am a veterinary assistant. What people often think is an emergency really isn't an emergency, and your pet will not die that night if we can't squeeze you in for a same-day appointment. For example, If your dog has a minor ear infection, it's not gonna die if we tell you that our earliest appointment is next week and we don't have any more available slots for the current day, especially not when we're about to close in an hour. We had a client with a GS insist that our dog needed to be seen now because it was an absolute emergency and that our dog was completely 100% non-ambulatory and that the dog, would need to be carried into the hospital via a stretcher. Dr. agreed to squeeze our dog in for an appointment during his lunchtime, and guess what? The dog was walking fine and our doctor didn't find anything significant even with radiographs. On the flip side, I'm pretty sure my cat hasn't peed in 24 hours. Gets you bring him in now. My roomie is a great example of a crap pet owner. Her chihuahua pulled 19 teeth last summer because her jaw was rotting away, something my roomie should have realized since the dog smells like death all the time. It's often fed pizza crust or cat food. Dog also doesn't eat properly due to tooth decay, yelps of pain from moving, urinates and defecates indoors because it's only walked 15 minutes per day, and the dog has developed stress behaviors such as separation anxiety, over-grooming and scratching the same spot for hours. I managed to adopt her cat though. She was gonna put that one down because it was peeing on the laundry and scratched up the furniture, mainly because the cat didn't have a litter box or a scratch post. Yep, my roomie is a complete waste of a person. Vet tech. Dogs and pancreatitis. It can happen by eating the wrong food once, and it can kill an otherwise healthy dog within 2-3 days. For the love of God, don't feed your dog table food. One intake of the wrong food can potentially cause pancreatitis. Most people think that we rarely do it, so it's okay to sneak some sausage to their dog during dinner. No. One time can trigger it and it can be extremely deadly. Also, hand in hand with this, if your dog isn't eating or drinking water, it needs medical attention. Don't wait a few days if it isn't drinking or eating. It will get dehydrated and it may die. If they're limping, straining, clamping one eye shut, they're in pain. They don't cry and whimper like we do. I'm not making up how serious heartworm disease is where I live in South Texas. Yes, even for cats, at least where I live, you won't dry out their hair coats by bathing them. Skin allergies are so prevalent here it actually really helps. You can socialize cats and acclimate them to carriers and car rides. I encourage you to do so. It'll make their 20-year lifespan so much more enjoyable for both of you. Please don't declaw you cats and crop your dog's ears. Don't pay a backyard breeder to rescue a puppy or kitten from them. Phew, looks like I had a lot to unload here. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.